How about insurance? In the developing world, when a spouse or a child dies, in so many countries, you are culturally obligated to put on a funeral. You must pay for a funeral. It often costs $100 or $200. Have some of you played the kids' game, the board game, Chutes and Ladders? So you're climbing up the ladder, and all of a sudden you hit a chute, and you go all the way back down. For poor people, their life is like that in so many ways. A death occurs, they are broke. They have to spend that $100 or $200. So our clients were asking us, they're saying, please help us in these situations. So we set up microinsurance policies. So within 6 days, usually less, we deliver the $200, $500 death benefit, so right when they need that money so they can pay for that funeral and not go broke. We've extended this insurance to other areas such as crop insurance. A farmer cannot get a loan if they don't have crop insurance, because if their crop fails, there's a drought, whatever other problem there may be, they'll go broke, and the lender knows the lender will not get paid back. With crop insurance, they can readily get loans to buy good fertilizer, good seeds, and grow a much more productive crop. We're going into livestock insurance, and now in the works is health insurance, which is a greatly demanded financial service. Micro schools of opportunity. We've realized that a number of our clients, their little business was setting up a school, typically renting a room, and educating the children of very poor people. Professor James Tooley, who chairs the education department at the University of Newcastle in England, has done a 7-year study and says these micro schools, the children get much higher marks on the standardized tests in various countries around the world than the children in the public schools where there are 110 children in a classroom. So we're actively looking to fund edupreneurs, these entrepreneurs who are setting up schools, providing superior education to children of very poor people. They charge $3 or $4 a month in tuition, and parents are lining up to pay this because it's much cheaper than having to pay for a bus ride each way for their children to attend the public school. So very exciting. One loan often affects 200, 500, 700 children. Another area is micropharmacies, microclinics. For $900, $1,000, we can provide a loan to a nurse. She will buy an inventory of pharmaceuticals which will treat the 5 most common ailments in Africa: dysentery, HIV, malaria, worms, tuberculosis. It is remarkable how in a rural community or remote area, or in a slum in a city where there was no other health care available, now that nurse is the healthcare provider. She's really like the doctor. She can prescribe 90% of what a physician can. They work extremely hard. I was in a couple of these in Kenya just a few months ago in the Kibera slum. And now with a small loan that's sustainable, they pay us back, and we can loan it out to another nurse who's setting up another micropharmacy. They're providing health care where there was none available before. Freedom from Hunger, another organization, they empower microfinance clients to sell health protection products. They go door to door selling insect-treated malaria bed nets and other health protection products. And just to name a few very quickly, other value-added services in microfinance: stoves that burn 40% less wood than the open fires which so many poor people have in their little shack. They have an open fire. All sorts of respiratory problems result from that. The children occasionally horribly fall into the fire. This is a very inexpensive stove. It pays for itself in 8 months from the wood that's saved. It's much more environmentally friendly. It has a chimney that goes out the little shack. Reading glasses. People lose their profession at age 40, 45 because they no longer have close-up vision. So for a couple dollars, we can empower a client to sell reading glasses, and the client provides for his or her family, and now people gain their whole profession back. Land, title, and housing, making micro-mortgages and helping poor people get title to their land in the developing world. And lastly, there are many, many more, just to name a few, but water purification bottles. This is a bottle that costs about $8. all the contaminated water you pour into it for about 3 months. It purifies the water, and it's good for a family of 5 for about 3 months. So very, very inexpensive ways to address some of the very significant problems. Basically what we're saying is that we figured out that this infrastructure that we've developed, this microfinance infrastructure is good, it's very good for delivering financial services, but it's also a great way to deliver other really high value-added services to the poor and to provide transforming ways and basic needs to help them not only work their way out of poverty, but also to maintain their health and to educate their children to permanently break the cycle of poverty. So just in summary, clients asked us, they said, thanks for making a loan. It helped us increase our income, but we need a safe place to save our money because the banks in the developing world exist to serve the 5% wealthiest people in the country, and they totally shut out the other 95%. So we open up banks, and to open up a bank account at our bank in Rwanda, the minimum opening account is $2. We want everyone to be able to come in and start saving because they gradually will build up that bank account over several months, a couple of years to $60, $70, and $80. So we provide a safe place to keep money. Insurance, protect against family catastrophes. We have 3.5 million clients now covered by insurance around the world. And then microclinics to provide health care. And again, this is just making a loan to a nurse who has this mini pharmacy. And then microschools, making a loan to a school proprietor, generally a woman who was a school teacher in the public schools before that got tired of the children not getting a good education, and she set up a school. And we're expanding this program aggressively. So this is more than lending. This really is transformation. Rotarians, you have eliminated polio in the world. I believe that if you come alongside microfinance and you've shown your interest by being here today, and you put in the effort into microfinance, working with Opportunity International and many of the other fine organizations in this field, that you can dramatically decrease the amount of poverty in the world, perhaps eradicate it. There are several forces coming together. Technology that we've spoken about, where we can lower the cost of financial transactions and reach more and more people, especially in the remote rural areas. Of the capital markets that are becoming available. As a grant is given to a microfinance institution, they can leverage that 3 and 4, sometimes 7 and 8 times. And then lastly, that there are business people, such as Rotarians coming in with their business skills and with capital to drive the scale up and increase our reach all the more rapidly than was ever possible before. So thank you so much for your great interest in helping people go from dire poverty to modest prosperity, go from degradation to dignity. Thank you.
I'd like to now introduce our third speaker and the lady who's going to run the program, Linda. I think she's giving me a Bible, but I don't like it to bring it down. Okay.